Welcome to the LDN Radio Show, brought to you by the LDN Research Trust. I'm your host, Linda Elseygood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. This show is sponsored by our members who made donations. We'd like to give them a very big thank you. We have to cover the monthly costs of the radio station's software, bandwidth, phone lines and phone calls to be able to continue with the radio show. And thank you for listening. Today my guest is Dr. Theresa Ramsey, who's an MMD from Arizona. Thank you for joining me, Theresa.
Thank you for having me.
So we're really excited to find out who Dr. Theresa Ramsey is. What led you to become a doctor? And why did you choose the naturopathic route?
Right. I wasn't looking to be a doctor. I was an RN, a nurse in the hospital setting, and I worked primarily in open heart surgery and in the emergency room. And I was happy working 3 12-hour shifts, but then, I think if we keep our minds open, we're always guided to where we're supposed to be. And I found myself in medical school when I didn't, want to go back to school. And it was difficult because the training I had was functional medicine, which means helping the body to, heal and be well on its own, stimulating its own healing response versus cutting out and suppressing. So it was a foreign idea to me, but some part of me, it made sense. And I stayed and I finished my schooling, my training, my internship, and I passed my boards. And then when I started practicing, it really changed my whole life, the way I look at life. Mm-hmm. And it's blessed myself, my family, and I've been now in practice for 22 years.
Wow. So what kind of patients were you treating before you found LDN? I mean, do you treat, from the cradle to the grave, or do you focus on adult medicine?
Well, we do cradle to grave in our office. I have fine-tuned my practice over the past 10 years. I'm a preventive aging specialist, which means hormone replacement therapy. Mm-hmm. And LDN falls in that. It's not a hormone, but it's an endorphin. So to me, it's like turning on something in the body that it can't do as well as it did when it was younger.
Mm-hmm. Well, that's interesting. Mm-hmm. So when did you first hear about LDN? How many years ago was that?
Well, I first heard about it 15 years ago, and although I didn't know much about it, I prescribed it to the one patient with Crohn's that asked me for it. But then recently, because there's so much more research on LDN, I would say I've been prescribing it daily since at least a year, maybe longer than a year, but it's rather new research that I came upon. Mm-hmm. And I've been prescribing it for so many conditions that I've been reading about in the literature on it.
And have you found your patients have any initial introductory side effects?
Some people have no side effects. Some people have minor side effects like dreaming, maybe a slight headache that doesn't really turn into anything worse. One patient felt good on it, and then she started to feel nauseous, but I don't know why. She stopped it. But I typically don't see side effects that last. And if I have a patient with side effects on the low dose, I wait to increase their dosage until their side effects go away, mm-hmm. which they do most often.
Yes. And do any of your patients choose to take their LDN in the morning?
Yes. If it affects the sleep, and I would say it's maybe 10%, I have them take it in the morning.
Mm-hmm. And just for the listeners out there, because there is always the discussions, should you take it in the morning? Should you take it in the evening? Does it work if you take it in the morning? In your experience, has it worked for those patients who take it in the morning?
They still get a benefit. And yes, and I have a few patients with chronic pain that take it morning and evening, and they find it works better double, taking it twice a day.
Mm-hmm. And that's another interesting topic. Could you go into a little bit more detail about how you dose for twice daily?
Okay, yes. Well, I start off typically with a 0.5 milligram, 0.5 milligram capsule. And just because the higher doses, if I start off with the dose I want to get to, which is 4.5 milligrams, I tend to see a lot more side effects.
Mm-hmm.
So if I start low, like with a 0.5 milligram, I tell my patients to go up to 1 milligram when they have no side effects. So if the first night they took it, they had no side effects, the very next day they take it, 2 capsules, and so on until we get up to 4.5 milligrams.
Okay. And when do you introduce the second dose? Do you start it immediately, or do you introduce the LDN first?
Yeah, I start it once a day at first, and I watch my patient's response. And if I'm getting a good clinical response, but they still have symptoms, that's when I start to introduce another dose, which is in the morning.
Okay.
So it's based on the clinical outcome.
Mm-hmm. And what about patients who come to see you with pain that are probably already taking an opiate-based painkiller? How do you get around that?
Right. I don't like to prescribe them at the same time. So it's really interesting here. I live in Arizona, and the law of medical marijuana is legal here. So I will switch them over to that first because that seems to be more tolerable than the narcotics. And they wean themselves off of it actually pretty quickly. I find that LDN treats pain really well, and even chronic pain. I've had patients on as many as 4 pain pills at one time, and one female stopped them just to start LDN, and within a month's time, she was off. She had no more pain, and she was just on LDN. She was amazed.
Wow,
I was
amazing.
too.
Yes.
I was too.
I have this conversation. We have some pain specialists that we have helping us, and it just amazes me how patients who are on fentanyl patches and morphine, where it's not touching the pain, and they wean themselves off, and they're on LDN, this little tiny pill that really doesn't do much, and it helps the pain tremendously. I've been told that the majority of people still feel some pain, but it's toned down so much that they can continue with their life. It's not at the forefront of their mind, the pain. And if you're in excruciating pain, having a niggle is bearable, isn't it?
Exactly.
Yes, if you've had terrible pain. So other than patients with pain issues, what other patients have you treated so far?
I use it a lot with autoimmune diseases. And to me, like the autoimmune could be cancer, autoimmune could be fibromyalgia, lupus, Sjogren's disease, even chronic fatigue syndrome. Mm-hmm. So I use it for anything that, because autoimmune is basically inflammation of the immune system, poor immune recognition, and therefore our cells don't really protect us. In those patients, I actually do see blood work change. I see their ANA antibodies go negative while the patient is able to tell me they're feeling better as well.
Mm. It's just so amazing. I'm always blown away by these stories. So the patients who have the autoimmune diseases, do they all have a similar kind of outcome, or do you find there are certain conditions that are better than others responding to LDN?
For autoimmune? I use it in all of them. And I think it's patient specific because there's just some patients, I don't think it's condition specific. I think it's patient specific. And I think, believe it or not, a lot of it has to do with the patient's belief system as well. Yeah. Because some patients have suffered so long, like either there's two extremes. They don't think anything's going to help them, or they're so ready for something new to help them. And I think the way they think about it and approach it has so much to do with their outcome.
And the other thing with LDN is the number of people who will say, well, how can LDN help with so many conditions? And we know there are over 240 that people have reported to have good results from. But exactly what you're saying is because they're autoimmune diseases, which is caused through all this inflammation. So it's not a case of it treating specifically all these conditions. It's treating the inflammation which all these conditions have. And being in functional medicine, I would believe, will actually treat the whole patient and not just the symptom. You will be looking at the underlying causes. Am I right? Yeah. And diet and lifestyle also has to be taken into account. I don't think LDN is a magic bullet that you can continue eating fast food and just sitting on the couch watching daytime television without moving and expecting LDN is going to put it all right, is it?
Yeah, exactly. I agree with you.
Yes. You've got to put some effort into it as well. That's what I was thinking.
Yeah, my patient population is used to lifestyle changes, and they don't expect a pill to fix them. I think LDN can because it's so powerful in what it does for every cell, but I agree with you. Our lifestyle and our outlook is 90% of our health outcomes.
Yes. And from the number of patients that I've spoken to in the last, how many years I've been doing this? 13 years. The people who respond better are those people with a positive outlook rather than the negative people, poor me, why did it happen to me? You don't know how ill I am.
Yeah.
Yes.
Exactly.
Yes, the frame of mind is also a big thing. And talking of which, a lot of people with an autoimmune disease, and especially those with pain elements to it, do feel depressed. Whether it's clinical depression or they're just depressed with the circumstances. Have you found that LDN has helped with depression and anxiety?
Yes, and I'm not sure if it's specific, having to do with serotonin or anything like that, but when patients feel better, they naturally are happier. I see that all the time. So I do think LDN treats depression, but it's not the traditional way antidepressants work, for sure. But when people feel better, their outlook does improve.
And also, people tell me that LDN helps them sleep better. And if you are having a good night's sleep, everything looks so much better in the morning, doesn't it, if you've actually had some sleep? Yes.
Yeah, and I definitely hear that, too. I hear people say they sleep a lot better, and then there's a few that say it makes them sleep worse. So
really?
I always hope it's the one that sleep better, because sleep is so important for our outlook, like you said.
Yes, exactly. I was going to ask you another question there. So have you ever used LDN outside of the box for things like infertility? That seems to be very successful. Or isn't infertility something that you get into in your practice?
We treat infertility a lot. I've never thought of LDN for infertility. But since you brought it up, I will start thinking. So, no, I have no experience with that.
Okay. If you Google Dr. Phil Boyle in Ireland, he's been using it for many years with amazing results. And he says that, these are women that not only have infertility issues, but have miscarriages and endometriosis and polycystic ovaries, all of these kind of women's issues, if you like, where LDN really does make a difference. And the people that get pregnant who have repeatedly miscarried or had been unable to get pregnant, it would seem that they have, a good pregnancy. He uses it before, obviously, to get them pregnant, during pregnancy and during breastfeeding. And he said that the baby's weights are always very good. They're very happy, contented babies. And as he did this survey, that they're less likely to have antibiotics for chest infections and things because they're healthier. So that, to me, is an absolutely amazing thing. So, yeah. And
Mm-hmm.
on a personal note, I used it I didn't use it for endometriosis. I had endometriosis, but I was diagnosed with multiple sclerosis. So the endometriosis had been going on for years, absolutely awful. I won't go into details. And after a few years on LDN, everything had stopped completely. In actual fact, it must have been a few months because I had another operation just before I started, and everything settled down. And I was talking to Dr. Phil Boyle after a conference in Scotland, I believe, and he was asking me questions about my health, and I was saying that I thought the endometriosis had stopped because of my age. I must have been about 50 at the time, thinking, menopause, it all stopped. And then he was asking me other questions and digging deeper, and it was actually the LDN that had done it. And touch wood, I have not had any problems at all, and I was repeatedly going in hospital. So, yeah, that was amazing.
Wow.
So, yeah. But I have found with some people, sorry to butt in there, that LDN I know you said it's patient dependent, but as a group, I would say the people who have told me who take LDN for psoriasis, that it does take longer for them to notice good results. Sometimes,
and when you say longer, what do you mean?
Like 6 months, even. Some of them have taken it for 6 months. It's taken the itch out, but it's still red and it's still not very nice. And then come the 6 months, all of those awful, I don't know what they call it, the scaly bits are dropping off, all the redness is going, and then there's clear skin underneath, which, if you know there's a good chance of that happening, stick with it. It's certainly worth it.
Absolutely.
Yes, I mean, because there's so many people suffer with that, and particularly another thing in the US, more so than here in England, is all the allergies that you have. That seems to be a really big thing there. I'm sure it will come eventually here, but everybody talks about allergies when I go to America, and I think, really, is it such a big thing? But LDN is used as well for allergies. I mean, is that something you have used it for?
Yes, for sure. And I think the reason we have so many allergies in our country is because the quality of food our government allows us to eat. I think allergies begin and end in the small intestine, where our immune system, 80% of our immune system is. And I'll tell you, our government allows, GMOs. I don't think you do.
No.
Just horrible. If you think about the Food and Drug Administration is one administration. So to me, the worse food we eat, the more drugs we're going to sell. So,
yes.
Well, of course, we're eating foods that inflame us and cause allergies. LDN, I've used for allergies. Once I've asked the patients also to improve their diet, et cetera, and it does seem to work really well at helping the immune system recognize, like, I don't have to inflame to the environment. I don't have to inflame to food anymore. That's a beautiful part about LDN, is it retrains the immune system.
And I don't know if you've heard of Dr. Tom O'Brien.
I don't know Dr. Tom O'Brien.
Okay, because he talks about gluten and gluten sensitivity, and he runs the Gluten Summit every year, and he's a speaker at the conferences that we've had, and how he explains how all the pesticides that are in food these days, the Roundup that you're actually digesting.
That's
and
right.
Of course, I think over there you're able to inject cows with or animals with antibiotics and things. And of course, whatever the animal is eating, then you eat it, digest it as well.
That's exactly right.
Which isn't good, is it? So
it's scary.
It is scary. And to think, years ago, in my grandparents' day, it was real food, and there wasn't such thing as processed food. My husband and I were talking the other day, when we were children, we can both remember having the first refrigerators. It was a big deal. And then, of course, freezers came later on. And but everything at that time used to be cooked fresh. You know, there wasn't any fast food with all the additives. Yes. And even though fast food, if you live on your own and you're not well and you can't manage to cook, it's a convenience for you. But I mean, they're usually quite high in fat and salt and sugar, which in turn isn't good for you, regardless of what the actual content is. Yes. So if we could all try and eat a bit fresher and a bit healthier.
That's very true.
Yeah. The LDN that you prescribe, I heard you say capsules. Do you do it in a liquid form, or do you prescribe it in a liquid form or sublingual if people have stomach problems?
I've never had to use anything but the capsule. And I've never, except for that one patient, had anybody get nauseous from it. So I only use the capsules because so far it's been very well tolerated with my patients.
Mm-hmm. That's good. Well, I would like you to tell people where you are and how they can get in touch with you. You know, website, email, telephone. Where you're based in Arizona.
Yeah, my practice is in Paradise Valley, Arizona, which is basically Scottsdale, Phoenix area. And our website is my name, Dr. Ramsey, at drramsey.com. That's my email. drramsey.com is our website. Mm-hmm. And our phone number is either 480 or 800-970-0077.
Wonderful. And it's called the Centre of Natural Healing, isn't it?
Right. Center for Natural Healing.
Yeah. Now, how easy is it for patients to make an appointment to come and see you? Do you have a waiting list?
Well, I have a waiting list, but I have other doctors in my office too, and we all work together. So if patients can't get into my schedule, they can get into another doctor in the office pretty quickly. And because we communicate about all the patients, if another doctor missed thinking about LDN, I'll help them, remember, because that's something I do every day. Mm-hmm. And my other doctors are getting used to it. So whether they get into my schedule or someone else's schedule, they're going to get the same care.
Wonderful. Well, thank you very much for sharing your experience with us. It's been amazing to get to talk to you. Thank you very much.
Thank you. I appreciate it.
This show is sponsored by our members who made donations. We'd like to give them a very big thank you. We have to cover the monthly costs of the radio station's software, bandwidth, phone lines and phone calls to be able to continue with the radio show. And thank you for listening. Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.